This segment of DelmarvaLife is sponsored by TidalHealth.
It's known as the silent killer. More than 11% of the U.S. population has it. Another nearly 10% doesn't even know they have it. We're talking about diabetes.
Yeah, it occurs when the pancreas does not produce insulin or the body cannot use the insulin it does produce. Symptoms can hit suddenly, they can be mild, and sometimes they take years to even be noticed.
Now, we are at the end of October. November is Diabetes Awareness Month, and we're getting a jump on spreading the awareness with Kelly Birch. She is a certified diabetes care and education specialist with TidalHealth. How are you?
I am wonderful.
Thank you so much for joining us today.
Oh, you're welcome.
Is there any specific special reason for November to be Diabetes Awareness Month?
Well, November is significant because in 1975, the American Diabetes Association declared that to be Diabetes Awareness Month.
Okay.
And then in 1981, Ronald Reagan went ahead and declared that as well for the, for the nation.
Right. Okay.
Okay.
And also in November on the 14th is Sir Frederick Banting's birthday. And he, along with Charles Best, discovered insulin. So it's kind of like a big, people love Christmas, they love December, right? November is my month. Yeah. It's Diabetes Awareness Month, and we got to get it out there.
And there are two types, type 1 and type 2. What's the difference between the two?
Well, the difference is the production of insulin. So people with type 1 don't make insulin. People with type 2 could still be making insulin, but they're not using it well. Sometimes their body's resistant to the insulin. But type 1s initially have to go, right on insulin.
So is there any way that we can help prevent contracting type 2?
Well, we can. Lifestyle, and that's hard for us, right?
Yeah.
Lifestyle is really hard. But, lifestyle changes, and we're learning now sometimes when people get a diagnosis of pre-diabetes,
right.
that losing weight, exercise, it's like 5 to 7% of weight loss. That's a decent amount to help with prevention, along with exercising. And when I tell you how much, you're going to go, oh, no. About 30 minutes a day, 5 days a week. So 150 minutes of exercise a week. But, it's definitely a way. And it's not that much, right? We could fit it in.
Okay, so let's talk a little bit about warning signs. There are early warning signs?
There are some warning signs, excessive thirst, excessive urination, dry itchy skin, blurred vision. So those are some signs of high blood sugars, and that could certainly be a telltale sign. But people blow those off a lot, because, in the summertime they're drinking more because, it's hot out.
Right.
Or they're urinating more often because I'm drinking more. Oh, I've got blurred vision, I'm getting older, So we sometimes, with those signs, we kind of, make excuses for them.
And blow it off. Okay, so we've got type 2. Is there something we can do to keep complications from getting worse?
Manage it.
Yeah?
Right? Manage it. So, goal, like 80 to 130 before meals, 2 hours after meals, less than 180. Those are our blood glucose goals.
Okay.
And then we always think that we call them the ABCs of diabetes. So the A1C, keeping that less than 7. Blood pressure, keeping that less than the 130/80, and cholesterol. And the LDL, we want that less than 70 for people with diabetes.
So is there something that we can do, communities and healthcare providers to do to support people with diabetes?
Yeah, send them to our classes.
Yeah.
There are diabetes classes, that we do. We do diabetes self-management classes, and we have dietitians. So, and we do so many amazing things. I'm going to push TidalHealth because I've been there for almost 30 years, and I love what we do. But TidalHealth Peninsula, we're going to have a diabetes awareness event coming up on November 11th from 5:30 to 7:30. We're going to have a team of doctors, Dr. Snitzer, Dr. Bott, Dr. Vivar, and Flora Glasgow from our pediatric side, doing like an expert panel. And then TidalHealth Nanacoke, we're going to have Dr. Padilla, who is an endocrinologist in Seaford. He's going to be speaking about exercise and why it's so important with diabetes, and that event will be on November 18th. from 5:30 to 8:30 at TidalHealth Nanacoke. So we've got some great things, and just kind of not really blowing my own horn, but we also have what's called a Journey Award coming up, and that will be on November 22nd. Not really open to the public, but it's for people who have been taking insulin for 75, 50, 25 years. They get a Journey Award for doing that. So, you know, I mean, because it's a journey
It
when,
is a journey.
you know, when you have diabetes.
Yeah.
So we've got lots of great things. We work with our population health team. We see patients in the hospital. We try to get them out of the hospital with somebody from our population health team. We have community wellness workers, community wellness nurses who are, you know, we're trying to help people manage their diabetes in any way that we can, giving them all of the tools they need to manage it. Because unfortunately it is, you know, I've had diabetes for almost 40 years. It's our disease to manage. You know, we have to do it, but if we can give them the tools to use to manage it, we can keep them healthy.
You can do it.
Yeah. All right. Well, thank you so much for coming in, Kelly.
Thank you
It's
for
always
having
good
me.
to see you.
I appreciate. I know, right? We're becoming like, you know, I'll see you next year.
See you next year.
Thank you so much.
You're welcome.